There are around 10 types of vaginal discharge. Some are normal, but some are abnormal. In this video, I will explain on the different types of vaginal discharges, the condition that can cause or can lead you to have those vaginal discharges, and the symptoms that can be associated with the discharges. Stay tuned until the end of this video. Vaginal discharge is termed in one category of any discharge that a woman experiences, may it be normal or abnormal. I will try to explain in details about 10 types of vaginal discharge and basically talk of the condition that you are most likely to be suffering from when you experience certain types of vaginal discharges. I have around 10, and these are the most common symptoms that many people experience or even you have ever experienced in your life. Majority of you tends to believe that any time that you have a discharge, it simply means you have an infection. What many people refer to, they refer to it as maybe a urinary tract infection, but not every discharge represents urinary tract infections. Because in most cases, in urinary tract infections, we do not have any vaginal discharge. So today, I will begin by a whitish discharge that we characterize it as thick and cheese-like. Anytime we experience this kind of a discharge, it simply tells you that you are suffering from a yeast infection or something that we can term as the vaginal candidiasis. The cause of this condition, it's not parasitic, it's not bacterial, but it's usually a fungal infection. The other signs and symptoms that can be associated with this kind of a discharge, it's whereby you experience itching in your vaginal areas, you experience swelling and pain around the vulva, and also painful sex. So anytime you experience the symptoms that I have talked about, accompanied by a whitish discharge that looks like cheese and it's thick, that simply means you are suffering from a fungal vaginal infection that we term to it as a vaginal candidiasis or a yeast infection. We have another type of a vaginal discharge that is a brownish or a discharge that is smelly or that is bloody. Anytime when you experience this kind of a discharge, it means that you have an irregular menstrual cycle, or in rare cases, you may be suffering from cervical or endometrial cancer. When you have this discharge, in most cases, it is associated with abnormal vaginal bleeding and also the pelvic pain. What we mean by pelvic pain, this is generally pain on your pelvis, alright? So anytime when you experience any kind of a brown discharge or blunt discharge, then it simply means that your menstrual cycle is somehow irregular. In most cases, or I mean in less cases, it can also be a warning sign of endometrial cancer or the cervical cancer. We have another type of discharge that is maybe cloudy or yellowish. So anytime you experience a vaginal discharge that is yellowish in color and somehow cloudy. What we mean by cloudy, and a good example of a cloudy discharge, it's any discharge that seems to look like a rice water. After you wash the rice, the water that appears, that's what we mean by a cloudy discharge. So any discharge that resembles a rice water, that's what we mean by a cloudy discharge. So in any case, when you experience that kind of discharge accompanied by bleeding between your periods, where you have issues with the urinary incontinence. What we mean by urinary incontinence is whereby you does not have the ability to hold your urine for a longer time, and also you have issues with the pelvic pain, then that one signifies that you might be having a sexually transmitted infection, and in most cases gonorrhea. When you have a yellow discharge or a green discharge that is very, very smelly, this simply means you are suffering from a condition that we refer to as trichomoniasis, all right? So you are suffering from trichomoniasis, a condition that is caused by a parasite. And this trichomoniasis is the only parasitic infection that is transmitted through sexual intercourse. And we refer to this parasite as Trichomonas vaginalis. So in most cases, patients will present with green or yellow discharge that is very, very smelly. In most cases, it is associated with the pain and itching when you are urinating. Remember, in other cases, in other situation whereby you can have the yellow discharge as a result of gonorrhea, you will have pelvic pain. But if trichomonias, you will only have this pain when you are urinating, and you will also experience itching when you are urinating. When you are not urinating, you will not experience any pain and you will not experience any itching. But the most common differential thing of this trichomoniasis is the green discharge accompanied by a foul smelling. All right. We also have another kind of discharge that is, it can be either white, it can be gray, it can be yellow, and fishy discharge that's smelling like fish. So if it happens you have this kind of a discharge, then you are most likely to be suffering from a condition that we refer to as bacterial vaginosis. Bacterial vaginosis is the inflammation, or in other words, is the swelling of the vaginal walls that is mostly caused by accumulation or excess buildup of the normal flora of the vagina. In every body part we have the normal flora, or what we term to as the normal bacteria that are supposed to be in that area. So if it happens this normal flora in the vaginal area continues to build up, then they can resort to bacterial vaginosis. In most cases you are most likely to have symptoms like itching. You will have symptoms like burning and redness and around your vulva. So what we mean by vulva, in other words, it's the lips of the vagina. You will experience itching and burning. On top of it, you will have yellow, white, or gray discharge. Then you are supposed to know that you are automatically having a condition that we refer to as bacterial vaginosis. All right. So in most cases, when people experience issues with itching, when people experience issues with burning and some discharge, almost every person tends to believe that they are suffering from a urinary tract infection, because you will hear almost every person telling you that they have an infection. But the truth of the matter is, in most cases, when you have the urinary tract infections, in most cases, you do not even have any discharge. When we talk of the yeast infection, it's mostly caused by fungus. One thing that can lead to this yeast infection growth, it's whereby there is a prolonged use of antibiotics. Because these antibiotics tend to keep on killing the normal flora of the body, they might end up killing the normal flora that are inside your vagina. So the purpose of these normal flora there, they try to balance the pH of your vaginal area. So if this normal flora dies, then the pH will change, and automatically the fungi around there will overgrow. That will lead to yeast infection. So if a person presents with signs of yeast infection, we does not manage this condition using antibiotics, but we treat it with antifungal. This whereby you can be given the pessaries. The pessaries, those are the medications that you insert into your vagina. Or we can also decide to give you the oral fluconazole capsules that we can give it as a single dose. Or if you have issues with too much discharges and accompanied by other symptoms, then we can decide to give the treatment as a 3-day course. Right? So, and in most cases also people experience this kind of a yeast infection immediately after their menses because of the imbalance of the hormones and the pH of your vagina will change automatically during your menses. And in this case, people also present with yeast infection after every menstrual cycle. When we talk of cloudy or the yellowish discharge that we said it's gonorrhea, that one automatically it's an STI condition that is transmitted when you have an unprotected sex with an infected person. So one of the treatment that we give in this condition, we just give antibiotics, a long-term treatment of antibiotics for days not less than 1 week. Some other times we can even manage this for 10 days or even up to 2 weeks, depending on the presentation of the patient, depending on the severity of the symptoms. All right. And even if it happens we do the culture and sensitivity, then we can decide on the duration of time that we'll give this treatment depending on the growth of the bacteria. When we talk about the trichomoniasis, remember I said this one is a condition that is caused by a parasite. So in this case, we do not give antibiotics. If it's caused by a parasite, then we try to give the treatment, the antiparasitic medications, all right? Because even if this one is transmitted through sexual intercourse, the main causative agent is a parasite. So if it happens we give antibiotics, it will not do anything because antibiotics are used to treat the bacteria. But if it's parasite, then we need to give the antiparasitic medications. All right. And in most cases, we can also give drugs like metronidazole. That one is also an antibiotic that we can also give it to cover. All right. When a patient presents with either white or gray or yellow discharge, that is very smelly. That one is caused by bacterial vaginosis. In this case, we also prescribe antibiotics in this case. All right. So there is also another discharge that is pink. Pink discharge is mostly experienced by women after they give birth. That one is a normal discharge. In most cases, even after some few cases of miscarriage, people still present with issues with the pink discharge. Some other people might even fail to see it as a discharge. They see it as a spotting. That one is normal, and medically we term that discharge as lochia. So we have types of lochia depending on the days and depending on the appearance. So this pink discharge, it's totally normal immediately after you have given birth, immediately after maybe miscarriage in most cases, or even after some days after your menses. After now your menses are over, you might experience some kind of spotting and they are somehow pinkish. When we talk of a normal vaginal discharge, the normal vaginal discharge, number one, it's not supposed to be smelly. It does not have any foul smell. And also, in most cases, it's not whitish, it is not clear, it's just in between there. And you are not supposed to have any issues with itching, any issues with the swelling, or maybe issues with painful urination or what. So what I needed to clarify here is, not every vaginal discharge symbolizes that you have urinary tract infection. The symptoms of urinary tract infections are totally different, where people will present with a painful urination, they will experience issues with pain, there is burning during urination, whereby you will be having issues with the frequent urge to urinate, or together with the frequent urge to urinate, every time when you urinate a little amount of urine. Those are some of the common signs and symptoms of vaginal discharge. So every type of a vaginal discharge means that you are suffering from this kind of infection. But the most common types of discharges that we have are white, we have green, and we have yellow. Those are the most types of discharges that people present with in the outpatient department. So even though all these discharges can be treated by use of antibiotics, it is usually very well to know what is the main cause of this discharge, so that if at all the discharge that you have, it's maybe yellow and it symbolizes maybe that one is an STI, it will help us so that we can also trace your partner and treat your partner, so that after having sex again, you will not be reinfected. All right. So all those are the common, and those are the most common types of vaginal discharges that you will experience. And every discharge carries the main cause. So after this video, I tend to believe that anytime when you experience any type of a vaginal discharge, you will not be at a rush to think maybe, well, you have maybe a green or you have white or gray discharge, then you tend to think that you are suffering from the urinary tract infections. Remember, I have said these discharge can either be fungal, can be parasitic, and can be bacterial. So depending on the type of the discharge, and depending on the cause of the discharge, that is where we get our treatment from. So that marks the end of this video, and I believe from here you have learned one or two things. So kindly consider to subscribe. You can share the link, and if you have any question, you can ask it in the comment section, and it will be our joy to answer you and to respond to every question.